IDDT stands for Integrated Dual Diagnosis Treatment, and it is a evidence-based practice that is utilized by programs that are community-based to reduce instances of hospitalizations, to reduce instability to housing, oftentimes intervenes in criminal justice issues, and obviously it increases the person's ability to remain sober. It increases their ability to have continuity of care, all of these things that happen. So I guess that's my favorite part, is just understanding that we're looking at a whole person, and the addictions part is important, but it's just a part of that person. And just by doing that alone, we're kind of actually having an answer to what society has basically treated them like as, just as an addict. We're saying, no, you're a whole person. And this process helps them actualize that.
The first thing the client needs to even consider, which might consider recovery or harm reduction or anything like that, is they need to be able to have a sense of hope that life can be good. And I think that that's one of the things that we do here, is we can help give them a sense of hope by helping them find purpose in the community and helping them connect with others in the community. And once they get a little bit of that sense of hope and the ability to visualize a happy future without using the same way. Well, there's a motivational interviewing approach is an important element of IDDT. We do that here. It's a way of thinking as a clinician. It emphasizes building a partnership with our clients and really working with them to explore their relationship to drugs and alcohol.
Some of the important elements of IDDT is to have a multidisciplinary team. Really important, because we want to look at all aspects of the client's care. Another thing is to have stage-wise interventions. So not only following their level of stages of change, but also having interventions that fit those stages of change is really important. Another element is to have what they call time unlimited services, meaning that we think in terms of a long-term process. So if we were to think in terms of short-term process, we're not allowing that really the practice to reach its highest results. And so we must think in terms of a long-term process. The other thing that's really important is having motivational interventions. This is all about meeting the client where it's at, and also it really helps when you're talking about harm reduction. And then, of course, specifically for substance abuse, you must have a group element, substance abuse group element, as much as possible. Get them out in the community to get a lot of peer support groups. You must have an individual substance abuse counseling element to it, and then attached to it is a really robust sort of psychiatric care and really robust family support. Within that family support, here at Ellenhorn, we do things like family modules, which is really a psychoeducational sessions with families. We also do things like we have recovery coaches, which really takes that psychoeducation and sort of in one-on-one sessions with certain families, we really coach them on how to have things like boundaries, practice self-care, how we help them try to really practice how they can really be supportive of their loved one's recovery without feeling like they're enabling or feeling like they're doing too little.
If they're at an action stage, it might not mean abstinence. It might mean that they're ready to try to reduce the harm the substance is causing in their life. And sometimes that means that the client will find out with an intentional plan we make together as a partnership that works, and they're able to moderate things and reduce the harm it's causing in their life. And sometimes the harm reduction approach is essential for the client to be able to realize that can't happen. And you can't skip that step, and in other places they skip that step.